Doing work with Oliver Ben, I worked with him for a session in my private practice so that he could get used to me and be familiar and know that he felt very comfortable around using hypnosis. He and his father came to the practice and we did some fun games of numbing the mouth. We went through the procedure of teaching him how to use hypnosis without anaesthetic, and he could numb his own mouth by using saliva in his mouth and rubbing his hand on his cheek. He was able to do this really well, and with just a little bit of encouragement here and there to remind him of what he's doing. So he's doing a wonderful job of rubbing the mouth and creating a saliva that he associates as the equivalent of a dental analgesia. For Oliver, the most important part, the most difficult part for him, in fact, was opening his mouth to begin with. As soon as he got to the point where he felt that he could open his mouth, the procedure itself, of course, was very short. Within this time, he did well to make sure and maintain a numbness in his mouth. For me, it was difficult to... I know that Oliver would have found it quite hard to hear me because of the dental equipment near the head, and just due to the space of the dentistry, I wasn't able to sit behind him, which I think would have been slightly more practical or slightly nearer his head. I used many techniques to make sure that he was continuously being relaxed through his body. It's important for me to be able to see the patient and if there's any tension in the body, so I continuously scan the body to see that everything's okay. The filling itself was done very quickly, and yet of course it was very close to the nerve, so you can see in Oliver's face that he's just becoming more aware of some of the sensations touching the areas that would have been probably quite excruciating pain under normal circumstances, yet he managed to breathe through them and let himself continuously get more relaxed. So he did a wonderful job of maintaining relaxation throughout his body.
Oh, really well done. Okay, fantastic. So it ended up being quite a very deep filling, and we were probably within a millimetre of where the nerve was, so that's why he was still flinching a tiny bit towards the last parts of the drilling, but it's all well and good. Fillings in the tooth now, but so we'll have to see how he gets on with it.
Can you tell me what you were doing 20 minutes ago? What was happening 20 minutes ago?
Don't know what we were doing exactly 20 minutes ago.
Well, approximately. Not long ago. What happened? Where were you?
Dentist.
And what happened?
Freedom.
Yeah. And how long ago? 20 minutes? Half an hour ago?
25 minutes ago.
And what are you doing now?
Eating. Hey.